Scripps Health is saying they have seen a 40% reduction in non-coronavirus ER visits lately. Now, at first glance, that may sound like a good thing, but this is worrying doctors. Here to talk about why, Dr. Ghazala Sharieff with Scripps Health. Thank you for joining us, Dr. Sharieff.
Thanks for having me.
So, are you concerned that some people may be avoiding the ER because they're afraid they're going to catch the coronavirus?
Yes, that is my concern. We've seen a drop for about 40%, as you mentioned. And my concern is that people are waiting until it's more severe before they come in, and we really want to let them know that it's safe. We have all kinds of protection in place, both for the patients and for the staff. I really don't want people waiting for things such as chest pain, shortness of breath, stroke symptoms, because time really is ticking and critical in those matters. And if you wait too long, you could risk the result in injury going forward.
Yeah, that is such an important point. And as you know, some of our most vulnerable with regard to the virus, older population can oftentimes have underlying conditions in which they need to see a doctor potentially on a regular basis. So what do you suggest and advise them to do if they feel like they're having some sort of other health issue and they need to see a doctor immediately? How do they go about it to make sure they also are safe with regard to coronavirus?
That's a perfect question, because it's exactly the same concern you have as those patients who have underlying severe disease. So if they're not sure, they should absolutely call their doctor's office. Sometimes we can just set them up with a telehealth visit, so they may not even need to come in person, which is also a safe alternative. But if you're having symptoms, sudden onset of shortness of breath, chest pain, we do want them to feel comfortable calling 911, because we don't want them to wait for an appointment if you're having a life-threatening emergency. And the paramedic agencies are doing a great job keeping their patients safe there, as well as when we're doing the same thing in the emergency department, separating the respiratory patients from those that have different conditions.
And as we've been reporting, of course, healthcare professionals and your protocols have changed, so you're taking a lot of precautions there to make sure that you keep people safe from the virus so that they can feel comfortable going to an ER without fear that they're going to catch it.
Yes, absolutely. We want everybody to feel confident in our ability. We have triage tents. You may have seen some of them outside our emergency departments, but we are seeing the respiratory patients completely separately from the other patients that are coming in for other complaints. So I do want our public to feel that they are very safe. And please come in if you're having a medical emergency. We hate for something to happen to you, and we do care about you.
Meanwhile, COVID-19 certainly is top of mind. So what are your suggestions? If there's someone at home who is feeling that they're having symptoms consistent with the coronavirus, what is the first thing they should do?
One, they can actually, depending how severe their symptoms are, if they're mild symptoms, they can definitely go to the website. For the CDC website is a very good source of information. They can call 211. We have a nurse line at Scripps that they can call if they have questions as well, and they can also contact their doctor's office.
And obviously, if there's severe symptoms that seem to come on suddenly, that would be a reason to visit the ER.
Exactly, or urgent care center.
All right, Dr. Gazzola Sharif, thank you so much for giving us your insights and helping kind of clear up some misconceptions here so that people will get medical care when they need it.
Thank you.